Hi, I'm Mary Lou Bagley. It's been 10 years now since we lost my dad. There were times when he needed help with virtually every aspect of his personal care. I learned the hard way how to help someone else with their daily hygiene, and I've always said someday I'm going to write a book about it. Well, that someday is finally here, and I was just working on the chapter on daily oral care. Oh, that was a tough one. It may surprise you to learn that more than 4 million people need help with daily oral hygiene. Some are old like my dad was. Others may be quite young but have a disability. Some are temporarily unable to care for themselves, while others need long-term care. But whoever they are, they rely upon someone else, I'm guessing that might be you, to keep the mouth free from bacteria that can cause disease. I'd like to point out 7 steps that may be important in assisting someone with their daily oral hygiene. See a dental professional to be sure that the person is not in pain. If the person you are helping is resisting your care, it could be because toothbrushing is making a painful situation worse. So please get that checked out first. Get everything you will need within reach before you begin. This may include toothbrush, toothpaste, gloves, a glass of water, a basin, a towel, and some kind of light. It will be more comfortable and more hygienic for you to wear protective gloves. If the person in your care has an allergy to latex, the pharmacist can order non-latex gloves for you. Rinse the gloves after you put them on to remove any powder that might create an unpleasant taste in the mouth. Experiment with how to position yourself so that both you and the person are comfortable. You may find it helpful to stand to the side or behind the person to help support the head as you brush. Be sure the person is in an upright position if possible. If not possible, ask a medical or dental professional for advice on how to clean the mouth. Be aware that when you provide daily oral hygiene, it's a package deal. You also get the responsibility of checking for oral problems that may need immediate professional attention. Check the mouth thoroughly before you begin brushing. You will need a good light for this purpose. Whenever possible, ask the person to rinse the mouth with water. This will clear the mouth so you can see better. Let the person be as independent as possible, even if it takes a little extra time. This allows the person a bit more dignity. Speak to the person about what you are doing, even if you don't think they understand. Use a soothing tone and continue to explain what you are doing as you proceed.
And check your tongue.
We all want to do the best for the person in our care, but that is often easier said than done, especially when you are trying to brush someone else's teeth and they can't or won't keep their mouth open. That's why Specialized Care Company has developed and patented the Open Wide Mouth Rest. Dentists have been using this product for over 10 years to help patients who have difficulty keeping the mouth open. It is made of non-latex high-density foam on the outside and a firm, stable construction on the inside to withstand strong biting pressure. It is also designed to be easy to hold as well as comfortable in the person's mouth. To use it, hold the mouth rest horizontally, then place it between the teeth on the side of the mouth. Once the mouth rest is in the mouth, turn it vertically. Notice that the mouth rest is not placed directly in front of the mouth. That's because the side and back teeth have a stronger root system and are meant to withstand biting pressure, whereas the front teeth are not. If the person clenches the teeth, making it difficult to gain access, try dipping the tip of the mouth rest in a little bit of jelly or applesauce. That should encourage her to open the mouth so you can insert the mouth rest. Brush the side of the mouth opposite the mouth rest. Once you finish brushing one side of the mouth, reposition the mouth rest on the other side. To do this, simply take the mouth rest out and reinsert it on the other side, or leave it in the mouth and move it around to the other side in small movements. Alternatively, you can use a second mouth rest to hold the mouth open as the first is removed. Even when the mouth is held steadily and reliably open, getting to the back side of the teeth with the toothbrush can still be a challenge when you are brushing someone else's teeth. That's why the surround brush is so helpful. It saves you time by allowing you to brush all surfaces of the teeth at once, and it helps you to do a better job. Here's how it works. When the brush is placed on the teeth, the soft, end-rounded bristles are positioned at the dentist-recommended 45-degree angle to thoroughly clean the gum line where food and bacteria hide. The short bristles at the top of the surround brush overlap to clean the biting surfaces of the teeth. If necessary, wiggle the brush a little to be sure you're reaching the gums on both sides of the teeth. Be sure to brush all areas of the mouth so that no area becomes an opportunity for trouble. Replace the brush every 3 to 4 months, or sooner if the bristles start to look worn. A worn brush simply cannot clean as well as a new brush. Remember, the biggest investment is your time, and you want the brush in good condition, so the end result will be the desired effect of keeping the mouth healthy. If the person wears full or partial dentures, they must be removed before you can properly clean the mouth. To do so, have the person puff out the cheeks in order to break the seal of the denture. Or hold the denture between your thumb and forefinger and use a gentle rocking motion to break the seal. Gently pull the denture down and turn it to the side to remove it from the mouth. Be careful handling the denture as it can be easily broken. To remove a partial denture, place a fingernail under the metal clasps on either side and gently loosen the clasp. Place equal force on both sides at the same time so the partial can be removed evenly from the mouth. It is important to brush the oral tissues of the mouth with a soft brush. Bacteria allowed to build up on the gums can cause oral infections and denture sores. So remember, every person needs the gums, roof of the mouth, and tongue brushed, whether there are natural teeth in the mouth or not. Brush the denture thoroughly to clean away all plaque and food debris. Do not use mouthwash or bleach to freshen the denture, as this may cause burns in the oral tissues from improper rinsing. Store the denture in a cup with warm water overnight. Each individual is different, and you may need to be aware of additional procedures and precautions for the person in your care. Be sure to check with a medical or dental professional if you are unsure about the care you are providing. There may be ways of making the job a lot easier for you and more pleasant for the person. Reach out and request help. There's lots out there if you just ask. Providing personal care for someone else is one of the toughest roles you may undertake. We hope this video will help make it a little easier and a lot more rewarding. Thanks for watching, and most of all, thanks for caring.